Hi everyone, thank you for watching tonight's Egg Whisperer show. My name is Dr. Amy and I'm a fertility expert in the San Francisco Bay Area. The topic of tonight's show is how to best prepare for IUI. IUI, what does it stand for, you might ask? It stands for intrauterine insemination. This is a procedure that's very commonly done in fertility clinics all over the world. So I thought it would be a really good idea to teach people everywhere the tips and tricks that I talk to my patients about so that they can have the highest chance for an IUI pregnancy. So let's get started. The first thing, oh wow, you'll see that I'm wearing a shirt that has the same logo to my left, the Tushy method. So the first thing I do is I make sure I know my patient's fertility diagnosis. You hear me say it over and over. Fertility diagnosis before treatment. So talk to your doctor about these 5 things. These are 5 simple steps that you can take to figure out what's going on with you to make sure that IUI is the right treatment plan. Let's start with tubes. T. We do a hysterosalpingogram to make sure the tubes are open. If one tube is blocked and one tube is open, you can still do IUI, but you want to make sure you're monitored because the cycles that you're ovulating from the blocked side are probably cycles you don't want to do IUI in. And when we ovulate, it's not like we ovulate every even month on the left side or odd month on the right. It's literally a flip of a coin. So without monitoring with a pelvic ultrasound, and we use the term follicular scan or follicle check, you would have no way of knowing. U is the uterus. An ultrasound of the uterus. I wish I can find an easy way so that patients can get their uterus checked without driving all the way to my office. You know, I'm thinking a wand that can hook up to your phone and you insert it vaginally, and then I get pinged, or we have an appointment where I can take a look at a screen and tell you exactly what's going on. But we don't have such a thing. So without a pelvic ultrasound to look at the uterus, you wouldn't know if you have cysts on your ovaries, a polyp in your uterus, a fibroid in your uterus that could block the pathway for an embryo to implant. So get a uterine ultrasound done before you consider IUI treatment. What's the next letter? S. For obvious reasons, you want to look at sperm health. There's so many things that you can do to get sperm to swim even faster and better. Lifestyle factors, vitamins, supplements, make sure there isn't a varicocele. So unless you check the sperm health, you wouldn't know what you could do on your own to increase your chances of pregnancy. See, my thing is, my shtick, is that I actually want everyone to get pregnant on their own without my help. I certainly know that that's not possible. But if I equip people with this information, guess what? Treatment might be more successful. So that's why I find that checking the sperm is really, really helpful. You know, I often hear things like, Dr. Amy, I was diagnosed with unexplained infertility. They said the sperm was slow, but they said it was unexplained. And I said, you know what? They told you what the explanation is, but I don't know why they didn't explain it better for you. The next letter, the next step, is the H, hormones. TSH, prolactin, these are hormones that if they're not balanced can cause problems with fertility. So before you start your IUI treatment, make sure you do a preconception panel including things like rubella, varicella, a blood type. How many of you guys know what your blood type is? Well, there's a reason why you want to know before pregnancy, and that's because if you're Rh negative, there's a shot you'll need if you have any spotting in your pregnancy. The last letter is Y, which is your genetic profile. Making sure that the egg and sperm are genetically compatible is super important to me, and that's why I like to do preconception genetic testing before I start an IUI cycle. So those are the elements of fertility diagnosis so that you can start your IUI cycle and feel like this is the right treatment for you. One of the questions I ask my patients is this: how many kids do you want? And then I look at their age, I look at their fertility factors, and then we talk about what do we have to do to plan for your future. So if, for example, you want 2 kids and you're starting IUI at 41, well, rethink that and talk to your doctor about what can I do to give myself the highest chance of having the family size that you want. What does that family look like? Certainly there's so many different ways of having a family, and I want you to reach your goals and have the family size that you want. So let's talk about the nuts and bolts of a fertility calendar. So some of the terms that we use are ovulation induction and IUI, and you're probably asking, wait, Amy, you said this was a show on how to best prepare for IUI. Why are you talking about ovulation? And that can sometimes be confusing. I have patients that ovulate regularly, and now I'm introducing ovulation pills. Well, there's a reason for that. See, every month you only ovulate 1 egg. But some people have a lot of people have the potential to ovulate more eggs. So what do? Well, we want to ovulate maybe 2 eggs. And I tell people when you take fertility pills, for example, you'll ovulate 1.5. And the reason for that is some months it might be 2 and some months it might be 1. And there's certainly some protocols, if you add injectables or you do a straight injectable IUI cycle, that you'll automatically, for the most part, ovulate 2 or more eggs if that's your potential. So talk to your doctor about what the goals are with treatment, what your pregnancy rate is, and how many cycles they expect you guys to do before you change the path to pregnancy. Meaning, at what point are you going to say, this probably isn't working for us and we should change course? So let's go through this calendar in detail. So first thing that happens is your period starts. So once your period starts, I tell patients, think of me and email me, because that means my work is not done. I look at my notes from our personalized fertility care plan that we've developed together, and then I formulate the calendar based on all the things that I just told you. Then on cycle day number 3, you're going to start a medication called Femera. You've probably heard a lot about Clomid, and if you've heard me talk about it, I call it crazy Clomid. I say, sure, you can take that drug if you want to schedule your exorcism later, because it totally can mess with your brain. A lot of my patients deal with depression and anxiety just because of the fertility problems they're having. So adding a medication that makes them feel a little bit more on edge isn't something that I want to do. The side effects of Femera are things that I talk to my patients about. Slight nausea is not unusual, a slight headache when you first start taking it, and maybe some lower leg cramps. The medication's only in your system for about 2 days or so. So those side effects should go away right away. And if you're having a lot of side effects, you know that you can let me know. And there are certain things that you can do to lessen the side effects. For example, rather than taking 3 tablets, go down to 2. And even go down to 1, for example, if you definitely don't want to ovulate 2 eggs and have a chance for twins. The other thing that you can do is play around with the dosing. Alternate 3, 2, 3, 2, 3, or take it 3 times a day, morning, noon, and night. I tell my patients to take the medication at night. The reason? You don't feel nauseous when you're asleep, so this can sometimes help. There's a reason also why we start the medication on cycle day number 3. The reason is our body picks the egg it's going to ovulate by day 5. So if you start earlier, there's a higher chance that you can rescue an extra egg. And the other thing you heard me just say is the word rescue. Fertility doctors are egg rescuers. We're not helping you get into menopause any sooner. You're not going to run out of your eggs any faster. We're just throwing out little life vests to your eggs so that you can ovulate an extra one. And hopefully it's kind of like a twofer. 2 chances for the sperm to hit 1 egg in 1 cycle. So in some cases that can increase a person's chance for pregnancy. So the next thing we talk about is sex. Yep, I talk about sex all day long from the minute I wake up till the minute I go to bed. It's not taboo in my office, and certainly not many doctors give their patients prescriptions for sex the way that I do. A lot of people think that they should abstain. As soon as their period starts in their IUI cycle, they should abstain from sex. That's not my approach. My approach is to recommend intercourse or sexual relations, or you can have outer course. And the reason why I say that is this. Ejaculation is a good thing. Think of it as practice makes perfect. I tell the guys, you're preparing for a big day, no pun intended. Your IUI is a day that I want really great, strong, healthy sperm cells. I don't want a whole bunch of dead swimmers. And that's what happens if you wait too long on your IUI day. And a lot of guys ask me, well, what happens on the IUI day? I'll get to that in a second. So sex is helpful, and the reason is, like I just told you, that we want really healthy sperm. But there's going to be a time where I may tell you, you know what? No more sex, because it's time for IUI planning, and my patients will get that information from me. So there's something called an OPK. I often find myself acting like a rap star. You know, there are all these acronyms, IUI and the OPK and the HCG. You know, I should really have a jingle. So if you're a songwriter out there, call me, because I would love to come up with a Tushy Method rap song to go along with these YouTube shows that I do. So with the OPK, the strategy is to not miss ovulation. Imagine that. You come in for your follicle check and you tell the doctor, I ovulated 3 days ago. And she's like, yeah. So that means we should have done the IUI 3 days ago. Why didn't you call me? So that's the thing. I'm like 7-Eleven. I'm open all the time. Call me. So if your OPK is positive, and my patients already know this already, you should see all the messages I get of OPKs and they're lined up and people are asking me like, is this positive yet? And that's the kind of stuff I like because I don't want to miss it. I know how important this is to my patients, and it's just as important to me that we time things as perfectly as we possibly can. So if the OPK is positive before the follicle check day, then I have patients come in for a follicle check and then we decide on the perfect IUI window. We'll talk about that in a second. So at the follicle check appointment, what we're doing is taking a look at the follicles. I'm measuring their sizes, I'm looking at the thickness of the lining of the uterus, and I'm determining when I think the IUI should be done. I'm thinking, okay, when should those eggs be in the fallopian tube and when should I put the sperm at the top of the uterus so that the magic will happen, okay? And so IUI is not like IVF. We have to rely on nature in order for the egg and sperm cell to come together, the embryo to travel down the fallopian tube for approximately 5 days before it sticks and grows in the lining of the uterus. So timing is important, but there's definitely a range. So once I've determined that it's time for us to do IUI planning, that's when we talk about the trigger shot. It sounds quite violent. I don't know who came up with that term. I like the term maybe the ovulation induction shot or the last stage of egg maturation shot. I haven't figured out a good term for it, but I'm sure I'll figure it out by the next show. So this is a small injection in the skin of your tummy. I do know that there are some clinics out there that do it in the butt, but there's nothing in the butt in my office when it comes to IUI. Okay, so the trigger shot, skin of your tummy, and typically it's timed approximately 36 hours before the IUI. And again, this timing is individualized. For me, it's based on, like I said, the thickness of the lining, the size of the follicles, the sperm quality as well, because sometimes I like to plan a double IUI. So that means, for example, if I gave a patient a trigger shot tonight, I actually have a patient, I'm giving her trigger shot tonight at 11 p.m. I'm going to do one IUI at 10:45 tomorrow and one IUI on Friday at 11 a.m. So that's why I'm timing the trigger shot in this way. So ask your doctor, why are you, if you don't know the answer and they haven't told you, say, how many eggs do you think are mature that I'm ovulating? And why are you giving me the trigger shot at the time that you're giving me? And is this IUI being timed perfect for us? And when should we have sex? Okay? After the IUI, I tell patients sex is recommended but not required, unless of course the sperm counts are on the lower side. If you hear me saying, you guys, you should definitely have sex after the IUI today, I can tell you that I've probably also discussed the semen analysis that we've done with the sperm wash, and we'll share with you those numbers at your appointment. So after the IUI, the other thing that we do, I know this sounds so complicated, but I want to make sure that you know all these steps. We start progesterone. Progesterone's a hormone that can promote implantation, right? It can't be a bad thing, but it can be in some patients. And I'll tell you who it can be bad in. People who have problems with their mood, depression. Progesterone can totally mess with your mood. So there are two ways of taking it. One is just pop the pill orally. That's how the pill was actually made. Or you can take the capsule and put it in your vagina. And I do already own the website farmgina.com for those of you who just had an idea. I don't know what I'm going to do with that, but maybe one day. So these capsules can literally, with your finger, or you can buy an applicator online for vaginal medications. You can just place them at the top of your vagina, but you might be dealing with a messy discharge. So what I find, and it's not like I invented this, but what patients report is that when you place a medication vaginally, you have less side effects. So I tell my patients, look, you can start it orally. If you feel crummy, let me know, place it vaginally. If you still feel crummy, we can reduce the dose to 100 milligrams. If you still feel crummy, we can stop the medication altogether. And that reminds me, I didn't talk about the side effects of the HCG trigger shot. You just heard a clue, HCG. Yep, that means pregnancy hormone. We use pregnancy hormone to induce ovulation. So don't go checking a pregnancy test within 8 days from the trigger shot. Why? Because a trigger shot can still be in your system for up to, sometimes it's even closer to 10 days. But for the most part, it's out of your system by 7 days. So now you're almost a fertility expert. And I can tell you that most of my patients know a heck of a ton about fertility. So now let's talk a little bit about my tips when it comes to medications. There's a website, goodrx.com. I am not a doctor who gets any money from anybody to talk about anything. Call me GoodRx. I can get paid. Just kidding. No chance. GoodRx.com has been a really helpful website for my patients, especially with in patients who, let's say, don't have insurance and medications who have not gone generic yet, or anyone who wants to save a buck. It's really helpful. So what you can see here is I've put in the term letrozole, which is the generic name for Femara. I put in the number of tablets that I want and my zip code, and here we go. You can see that it's super cheap at Costco. 15 tablets is $8.70. There you go. I would say about 95% of the pharmacists are pretty cool about honoring this coupon. Once in a while, there's a snarky pharmacist out there. Hey man, I get snarky too. So, if you're having a bad day, you're having a bad day. So make sure if a pharmacist is kind of resisting that you're able to use this coupon, just walk away and go to Costco. So another prescription that I prescribe is the Prometrium or the progesterone. Same thing. You can see here that I put in the term progesterone, 200 milligrams, 30 tablets. At Safeway, it's $20.80. And you have other alternatives too. Walmart, $22, Costco, $23. Cool. And then the other medication I dispense from the office, and that's the trigger shot or HCG shot. So it's a small shot in the skin of your tummy, and I tell patients to refrigerate it when they get home, or I also dispense it. I also give it in the office, depending on how we want to time the IUI procedure. So now let's get into the procedure. Oh no, this thing, yeah, not our friend, not my friend at least. So if that's not my friend, I'm going to make sure that I'm doing a speculum exam on a patient in the gentlest way possible. And look, I know not everyone can tolerate a speculum exam, but that's what's involved in an IUI procedure. So I ask my patients when you're coming in, I make sure that if they need a Valium 30 minutes before, it's already offered. And we've talked about it because a lot of patients will report, and I can even tell when I do a pelvic ultrasound, that maybe they'd be better off with a Valium before the IUI procedure. So I would say probably only 5% or less of my patients need a Valium, but I want to make sure that they're as comfortable as possible. So I ask them to come in with a full bladder. That way the uterus is leaned back. And then I place the speculum, and then we place the catheter at the top of the uterus and shoot the swimmers in. And then sometimes I like to also place an abdominal ultrasound over the tummy so that I can take a look directly and see that the catheter is in the right place. So if you find that your doctor or provider is having a hard time getting in with a catheter, here's what you can do. You can say, you know what, guys, I think I want to drink a little bit more water. My bladder doesn't feel too full. And then say, hey, do you guys have an abdominal ultrasound? I heard it might help you see where you can go. I think sometimes people struggle and they don't realize that they have the tools right there to help them, a bladder and an ultrasound. So I want to thank you guys for watching tonight's show. And there are a couple things that we didn't talk about. So here are a couple things. I'm coming out with a sperm snuggie. I am. It's a scarf. It has 2 pockets so that when your partner is collecting a sperm sample at home, you can just put it in your pocket and bring it over to the fertility clinic, and it's going to stay nice and warm. I'm just kidding. But literally, sperm can live outside the body for quite a long time and nothing can happen to it. So if I have a patient that lives within 30 minutes of my office, we give them a cup, they can collect at home and bring it in their sperm snuggie, or your armpit, or your boobs, or a pocket, okay? Once it comes in, we identify everybody and make sure that we have everyone's name, everything is labeled, and the sperm wash to get the sperm sparkling clean takes about 30 minutes, okay? And then when you're in the IUI room, I walk in and I ask my patients, do you want to put your headphones on or listen to a song so that things can be as romantic as possible? And then I also ask the partner if they want to push the end of the syringe, if they feel comfortable doing it. So it's a group effort, everyone's involved, and everyone's having as relaxed of a time as possible. So I hope this show is really helpful. I hope that, if you know someone going through IUI treatment and you think that maybe this show will be helpful to them, that you can forward this to them. So I hope you guys have a great night. Be sure to subscribe to my YouTube channel, listen to my podcasts, and read my articles on Medium and dramy.org. Have a great night, you guys, and see you next week.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.